It's October the 1st, and the Affordable Care Act is finally getting its rollout. But President Barack Obama's health care law looks a lot different than it did when it originally was rolled out. WSJ health policy reporter Louise Radnofsky joins us now to talk about this. It's finally here. It's rolling out about 40 minutes ago here in New York. The exchanges opened. You could go look for stuff. What's changed?
A lot has changed, almost so much that the law is rolling out more with a whimper than with a bang, even without the shutdown distraction that many advocates feel is in some way creating a new landscape for it. It's smaller than people thought it would be. The American people always understood it to be a very big sweeping law, and in reality it actually only really affected a small sliver of the population who don't have access to coverage through a job or through a government program already. Those people in the individual market or people who don't have coverage right now are hugely affected by the law. Many of them don't know about it. Some of them won't get the help that they might have otherwise because of a Supreme Court decision that made Medicaid participation optional for the states. And so there are a number of ways in which, even after all of this is done, the 55 million people that CBO estimates to be uninsured right now will be reduced to a number of, in 2023, 31 million. There'll still be 31 million people left without coverage if everything goes according to plan.
Now, other changes are that there's been a delay in the employer mandate, right? Explain what's going on there.
That came in the summer. The most important thing about that delay is why it happened. It has a negligible impact on the number of people who gain coverage in the first year or so. It happened because it was hard to get the computer systems up and running in which the employers would talk to the government and the government agencies would talk to each other. It was a huge technical challenge. It was a huge climb down for the administration to offer to delay the requirement that employers provide coverage or pay a penalty for a year. And when they did announce that they were delaying that, of course, the floodgates opened and politicians from both parties actually started to use this as a moment to start to ask for other parts of the law to be delayed or, in Democrats' case, to be changed.
And was that like pulling on a string? Is that you don't want to pull on a string because a lot of things start to unravel, and we know that one of the things that some congressional Republicans are asking for is that, okay, so the employer mandate was delayed a year, delay the individual mandate too, which is the point where you have to pay a penalty if you don't have insurance.
Well, just remember that in the 3.5 years since the law was signed, which is quite a long time for a rollout, although a very short time for the amount of work that the federal government's been trying to do to get this running, there have been lots of strings tugged. And of course, the individual mandate in particular is a string that was tugged very, very hard by opponents of the law who tried to use it as the focus of a Supreme Court case to bring down the entire law. They didn't succeed in that. Of course, it's a focus again in discussions, and certainly it's one of the most unpopular provisions of the law, but it's also the one that supporters say is necessary to make the insurance provisions work. They're probably not going to be letting go of that string anytime soon.
Louise, we've been hearing all about the budget battles and the government shutdown. If the budget shutdown, if the budget negotiations go the way of the Republicans, is it even possible to unwind the Affordable Care Act?
Well, getting to October 1st was for supporters a key issue. They wanted to have the provisions up and running, partly so that in theory nobody could tamper with them. It wouldn't be out of the question that they could be rolled back. There have been programs that have been rolled back before. There are not a huge number of people who are expected to sign up in the early days, which is both a complicating factor for supporters and also a bit of a blessing because they're aware that the exchanges still have some glitches that need to be worked out. So it would be difficult. More than that, it would be politically unpalatable to people who've spent months, years working to get to this point.
Okay, great stuff. Thank you very much. Louise Radnofsky of the Wall Street Journal. We appreciate your time.